Dear students, welcome to the online classes of Clinical Pharmacy 1. This is your course lecturer, Yasser Abbasi. I hope you are enjoying learning experience at Hamdard University's learning management system. I am sorry for delayed uploading of these lectures to online portal, as I was facing some hardware problems with personal computer. So, let's start studying clinical pharmacy. The term clinical pharmacy is relatively new in developing countries such as Pakistan. Awareness of this field among pharmacy professionals has followed the transformation from Bachelor of Pharmacy degree to Doctor of Pharmacy degree in 2004. This new 5-year program not only includes the word doctor in its title but also has shifted the focus of pharmacist from dispensing of drugs to patient-oriented pharmaceutical care. Clinical pharmacy is an important aspect of this advanced degree, which requires a great deal of attention and clinical skills. Since the implementation of Pharm D degree programs, clinical pharmacy has become the core of the profession. It has given new dimensions to the field of pharmacy in the form of pharmaceutical care, evidence-based practice, and quality assurance. This is our first online lecture, and we will see the outline of the course Clinical Pharmacy for first semester of 4th Professional. In this course we have 6 units. Each unit is further divided into multiple subtopics. In General Introduction to Clinical Pharmacy, we will have the orientation of clinical pharmacy profession. We will discuss and understand various terms and definitions which are related to the theory and practice of clinical pharmacy. This is followed by patient profile and patient counseling. Patient profile is a report of patient's disease progress including the information and reasoning behind the diagnosis and the management decision. The purpose of patient profile is to provide a history of patient's previous medication including a note of idiosyncrasy, adverse drug reaction, allergies together with a record of his or her current medication. Patient profile enables the practitioners and pharmacist to monitor patient's medication. We will learn to understand and develop patient profiles because it is the basic responsibility of clinical pharmacists to assess the status of the patient's health problems, and determine whether the prescribed medications are optimally meeting the patient's needs and goals of care. Patient counseling refers to the process of providing vital information, advice and assistance to help the patients with their medications, and to ensure that patients take their medications properly. We will study what are the primary functions of patient counseling, and how communication process between health professionals and patients serves efficiently. Once we have completed patient profile and counseling, we will see the basics of clinical trials of drug substances. This will help us to understand the procedures through which a drug passes before it is available for the patients in the market. Clinical trials are conducted to collect data regarding the safety and efficacy of new drug and device development. A clinical trial involves the testing of a new medicine, or other therapy, to evaluate whether it is effective and safe. Clinical trials of drugs can be divided into those assessing the treatment of a disease, for example asthma, or those assessing treatments to prevent the occurrence of significant healthcare events in the future, for example stroke. We will study the approval processes, ethical requirements, and general conduct of clinical trials. We will also study few clinical trials to understand them efficiently. Emergency medicine, also known as accident and emergency medicine, is the medical specialty concerned with the care of illnesses or injuries requiring immediate medical attention. We will study this topic from the perspective and job description of a health system pharmacist. The topic of emergency treatment shall follow topic of drug interactions. A drug interaction is a reaction between two, or more, drugs or between a drug and a food, beverage, or supplement. Taking a drug while having certain medical conditions can also cause a drug interaction. Drug interactions are widely acknowledged and can interfere with the management of clinical cases. We will study various drug interactions, their mechanisms, and their impact on pharmacotherapy. Finally, we will discuss pharmacovigilance, which is the practice of monitoring the effects of medical drugs after they have been licensed for use, especially in order to identify and evaluate previously unreported adverse reactions. No drug which is pharmacologically effective is without hazard. Furthermore, not all hazards can be known before a drug is marketed. Therefore, it becomes necessary to continuously monitor the drugs for their unwanted effects, after they are being used in the market. You can find that topic of drug interactions and pharmacovigilance are interrelated. The succeeding slides provide subtopics of each main topic. As we have discussed that Part 1 should provide an orientation to the profession of clinical pharmacy, introduction to various terms and definitions. Here we will also study the basic components of the clinical pharmacy. We will compare clinical pharmacy with various other healthcare professions and different working areas of a pharmacist. Introduction of clinical pharmacy shall provide an overview of the scope of services provided by clinical pharmacist. The use of clinical practice guidelines, CPGs, for the medication management of patients with a wide variety of disease states has been common practice in healthcare settings for decades. The clinical practice guidelines have been developed for many diseases including diabetes, cardiovascular diseases, respiratory diseases, cancer management, and many more. In addition to guidelines for disease and therapy management, there are various guidelines developed for the services of clinical pharmacy. For example, adverse drug reaction management, patient communication, medication therapy management, etc. They can define or recommend specific diagnostic, treatment, or prevention approaches, and are based on evidence from a systematic review of the published literature on a given disease or disorder. The extensive spectrum of clinical concerns covered by these types of guidelines includes diagnostic tests that are most appropriate in a given situation, fracture prevention measures for postmenopausal patients with osteoporosis, or informing the decision regarding use of surgical procedures versus other treatments for life-threatening conditions such as prostate cancer, to name a few. Best current practice uses relevant findings from well-designed, systematic, randomized clinical trials to identify care options that are supported by evidence-based recommendations. Evidence-based treatment refers to the best treatment practices. Most developed and many developing countries authorize their ministries of health to develop clinical practice guidelines, and to make sure that these guidelines are followed effectively. There is another somewhat related concept that is also widely used, is called comparative effectiveness, and defined as a type of research that compares how different treatments, tests, or procedures for specific conditions have worked for others. Both concepts relate to clinical practice guidelines. We will have an introduction to these guidelines and will discuss each relevant guideline with reference to disease or therapeutic management. I guess we will have detailed study of individual guideline related to a given disease, in second semester of 2020. The general guidelines for clinical pharmacists are mainly devised by American College of Clinical Pharmacists and American Society of Health System Pharmacists. For example, Standards of Practice for Clinical Pharmacists by American College of Clinical Pharmacists guides about process of care, documentation in clinical pharmacy, collaborative, team-based practice and privileging, and about professionalism and ethics. Similarly, the American Society of Health System Pharmacists, ASHP, develops official professional policies, in the form of policy positions and guidance documents, that is, statements and guidelines, for the continuum of pharmacy practice settings in integrated health systems. The clinical pharmacists associations in different countries have also devised their own clinical pharmacy practice guidelines. Millions of laboratory tests are requested each year, and these are used to monitor patients and to help diagnosis as well. The use of clinical laboratory test results in diagnostic decision-making is an integral part of clinical medicine. The menu of laboratory tests available to clinicians constitutes an impressive array that has expanded exponentially since 1920, when Folin and Wu devised the first useful test for the quantification of serum glucose concentration. The current list of tests offered by one major reference laboratory includes nearly 3,000 analytes, which does not include the additional array of more commonly ordered tests, for example, complete blood count, electrolytes, thyroid-stimulating hormone, blood glucose and many more. Upon completion of laboratory data interpretation, you will be able to recognize normal ranges for common laboratory values in adults, identify common causes for abnormal laboratory values, list circumstances that may produce false negative or false positive laboratory results, interpret the clinical significance of abnormal laboratory values, utilize clinical laboratory data to monitor various disease states. However, when we will study diseases like cardiovascular diseases, diabetes, asthma, arthritis, etc., we will also have an understanding of which laboratory tests are appropriate to order in the diagnosis and follow-up of a patient's medical condition with reference to the disease under study. This understanding should include answers to following questions: why is the test being ordered? What are the consequences of not ordering the test? How good is the test in discriminating between health versus disease? How are the test results interpreted? How will the test results influence patient management and outcome? Well over half of the body's weight is made up of water. It is stated about the body's water as being restricted to various spaces, called fluid compartments. As you already know that the three main compartments are, fluid within cells, fluid in the space around cells, and blood. To function normally, the body must keep fluid levels from varying too much in these areas. Some minerals are important as electrolytes, especially the macrominerals, which the minerals the body needs in relatively large amounts. Electrolytes are minerals that carry an electric charge when they are dissolved in a liquid such as blood. The blood electrolytes, that is sodium, potassium, chloride, and bicarbonate, help regulate nerve and muscle function and maintain acid-base balance and water balance. Electrolytes, particularly sodium, help the body maintain normal fluid levels in the fluid compartments because the amount of fluid a compartment contains depends on the amount, concentration, of electrolytes in it. If the electrolyte concentration is high, fluid moves into that compartment, a process called osmosis. Likewise, if the electrolyte concentration is low, fluid moves out of that compartment. To adjust fluid levels, the body can actively move electrolytes in or out of cells. Thus, having electrolytes in the right concentrations, called electrolyte balance, is important in maintaining fluid balance among the compartments. If the balance of electrolytes is disturbed, disorders can develop. We will study electrolyte management in different disease states. Pharmacy students typically believe that if it is published, then it must be true because all articles are reviewed before they are published. However, pharmacy students quickly learn, after their preceptor points out countless limitations in the seemingly perfect article they are presenting during journal club, that most, if not all, articles have limitations. With the biomedical literature expanding at an incredible rate, literature evaluation skills are critical to determine which articles should change pharmacists' current practice. Pharmacists frequently are faced with questions during rounds regarding recently published articles and need to have the skills to decide if the results of these trials should be applied to patient care. Pharmacists involved with the Pharmacy and Therapeutics Committee of a hospital also have to evaluate critically the literature to determine if a drug should be included on the formulary. In addition, the increased complexity of clinical trials has made literature evaluation more difficult. Therefore, pharmacists need to improve their literature evaluation skills to decide which information to incorporate into their clinical practice. Under clinical literature evaluation, we will learn how to justify the need for literature evaluation to optimize drug therapy. Compare and evaluate the different types of resources available to assess and resolve drug-related problems. Assess the different sections of a published study for comprehensiveness and quality. Distinguish between the different types of clinical trial designs and determine the appropriateness of each for the research hypothesis in question. Evaluate the primary literature for the presence of bias and confounding variables to determine their effect on validity and applicability. Apply the concepts and techniques reviewed in this chapter to critically evaluate the medical literature and applicability of these results to patient care. As we discussed in previous slide, drug interactions are widely acknowledged and can interfere with the management of clinical cases. Here in Unit 1, we will overview basics of drug interactions. Then in Unit 5, we will discuss drug interactions in detail. The goal of medication therapy is the achievement of defined therapeutic outcomes that improve a patient's quality of life while minimizing patient risk. There are inherent risks, both known and unknown, associated with the use of medications, either for prescription and non-prescription medications. One of such risk is medication error. A medication error is a failure in the treatment process that leads to, or has the potential to lead to, the harm for the patient. We will study the experts' in-depth analysis of errors in prescribing, dispensing, drug administration, and use of drug delivery devices. We will also evaluate the role of the pharmacists in preventing medication errors. As we have discussed previously, patient profile is a report of patient's disease progress, including the information and reasoning behind the diagnosis and the management decision. In addition to detailed discussions about patient disease profile, process of taking case history, and patient counseling, we will also review the drugs profiles. Drug profile provides a concise review of the pharmacology, clinical efficacy and tolerability of a drug. As we have discussed in previous slide, the clinical trials are conducted to collect data regarding the safety and efficacy of new drug. In this section we will study the types, phases, and design of clinical trials. And we will get an overview of how the participants are enrolled or excluded from clinical trials. In this section, we will study epidemiology, physiology, pathology, and pharmacotherapy of some emergency diseases. As mentioned earlier, this section will include in-depth study of drug interactions, including their types, physiological mechanism and factors, and on top of all, the most important one, the role of pharmacist in preventing and management of drug interactions. Pharmacovigilance is the process of monitoring the drug performance once it has been entered into market. We will study few cases that show how a new drug caused big disasters for health system in history. We will justify the need of pharmacovigilance and study its process and classification. Please note again that adverse drug events come under the domain of pharmacovigilance. The reading material will refer according to topic. Generally, we will refer various primary literatures and clinical guideline. You can consult with Clinical Pharmacy and Therapeutics, the latest edition of Roger Walker's Clinical Pharmacy and Therapeutics. DePiero's Pharmacotherapy and Coda Kimball and Young's Applied Therapeutics are two other textbooks for thorough study of pharmacotherapy in various diseases. As we have outlined the course of clinical pharmacy for the fourth professional of PharmD, let's the assess criteria for this course. The assessment will follow the policy guidelines of Department of Examination, Hamdard University. You should be well aware of assessment criteria followed in Faculty of Pharmacy. However, due to current pandemic situation of coronavirus, the policy will depend on upcoming scenarios. The soft copy of these slides have been uploaded on Hamdard University's Learning Management System. You can also find there a link to download this video. You can direct your queries to the given email. This is all about today's orientation. Happy month of Ramadan. Stay safe and blessed. Allah Hafiz.